Hi, my name is Dr. Ami Dakshini and I'm a dermatologist. Are you feeling that your skin is very red, flaky, and tight no matter what you do or what you apply? I think that's when your skin barrier has got affected. So let's understand why the skin barrier gets damaged and what should we do about it. So these are some signs of skin barrier damage. The first is red, flaky, tight and dry looking skin. Second is if you notice that after cleansing your face, the skin feels dry and stretched. If you notice that while you're applying your regular skincare routine, the skin is burning or irritation is visible, especially after using water-based products. Sometimes you notice sudden increase in breakouts and a dehydrated skin, although there is increased oil production. All of these signs are telling you that the skin barrier is damaged and you need to do something about it. So, our skin is an equivalent to a wall where the bricks are our skin cells and the cement or the mortar in between the ceramides or the emollients. Now, when you start noticing redness and flaking of skin, you know that the barrier is damaged. So, what will help rejoin these cells and prevent the barrier damage? First are your ceramides, your cholesterol, and your fatty acid containing creams and lotions. They will help repair this and get the skin cells coming back together. You also have certain occlusives like your natural oils or petroleum jelly, which will prevent excessive water loss from the surface of the skin. Of course, cooling agents like aloe vera gel, you have zinc containing pastes or colloidal oat containing creams which soothe the skin, reduce the inflammation, the tightening, and the stretching. If you're looking at natural oils, look at oils which are lighter, like squalane or rosehip oil, which mimic our sebum of the natural healthy skin. So that will get you back the barrier, skin barrier, and will prevent excess water loss from the surface of the skin. So if you're layering your skin with multiple products, it's called the skin buffet effect. Now, if that is the condition, you might notice after a while that your skin starts looking dry and flaky. The reason being that too many products put together can irritate the skin. One, because the pH becomes unbalanced and the skin can start peeling in an acidic or alkaline environment. Second is that when you start combining exfoliants together, like a retinol and a salicylic acid or a vitamin C at the same time, or if you're double cleansing every single day without using makeup, it can again strip your skin of natural lipids which are produced as protective mechanisms. It could happen if you're using your scrubs or you're exfoliating with loofahs very frequently. All these things can cause barrier damage and it can lead to skin peeling and irritation. So, what is the difference between hydration and moisturization? Hydration is nothing but increasing the water content of the skin. So, here is where you add all your humectants. These ingredients which absorb the water from the environment, also from the deeper layers of the skin, so that it improves the water content of the superficial layers of the skin. The commonest ingredients that we use in skincare are your glycerine, which is a gold standard humectant, or hyaluronic acid, which could be low or high molecular weight hyaluronic acid, and aloe vera gel, which we use so commonly. These humectants absorb water, plump up the skin, and make it feel hydrated. So it's like watering a plant. But moisturization is much more, it's much deeper. Moisturizers contain three ingredients: humectants, emollients, and occlusives, because in totality, that's how you can keep your skin hydrated and moisturized. Here, the emollients work by binding the skin cells together, like your ceramides. The humectants, like your aloe and hyaluronic acid, help absorb water, and your occlusives like petroleum jelly or natural oils will prevent this water from getting evaporated into the atmosphere. So when your skin barrier is damaged, we know that we need to reset the skin and we need to give it rest for the next 7 to 10 days. So the first thing you need to do is stop all your actives, give it rest. Start your morning daycare routine with just a gentle cleanser or maybe just plain rinsing with water. Apply a moisturizer which is more like an emollient containing ceramides or just fatty acids or simple cholesterol, and then apply an SPF or a sunscreen which contains both UVA and UVB protection, so a broad spectrum sunscreen, which is preferably medicated because it contains no color, no fragrance, above SPF of 30, as well as with a PA factor of 3 plus. Your nighttime routine should include a very gentle cleanser, which is pH balanced, preferably a non-foaming cleanser. On top of that, you use your humectants, so either your aloe gel, glycerine, or hyaluronic acid. On top of that, apply a very mild oil like a squalane oil, which can retain the moisture below. And if required, apply an occlusive like petroleum jelly.